So the educational objectives for this talk will be, again, covering the patient preparation, as we emphasized in the previous study, or the previous talk. Indications and contraindications for using gallbladder stimulation, how to select the optimal protocol for gallbladder stimulation techniques, a stepwise approach to the interpretation of the studies, as well as imaging findings that lead to a diagnosis that may be unrelated to the gallbladder, but may also, in some cases, explain the patient's presenting symptoms. So we're going to start with the first case. This is a 36-year-old female who is ambulatory, walkie-talkie, comes into the office for a routine gallbladder stimulation scan to evaluate chronic intermittent abdominal pain, sometimes associated with meals, sometimes not, otherwise feeling well, right? Typical presentation for a patient like this, chronic abdominal pain, no abnormalities on physical exam. She followed the standard test prep precisely, the way that she was instructed to. She had a fatty snack the evening before the exam and has been fasting since that time, and we're doing this study first thing in the morning. So we could see here progressive filling of the gallbladder, very nice excretion from the hepatic parenchyma. And so following a structured interrogation of the images and coming up with our report, is the liver uptake tracer normal? Yes, it is. There we go. Is the parenchymal activity, is there a parenchymal abnormality? Spoiler alert, no. Is there gallbladder visualization? Yes, I think we can agree on that. Is there a tracer washout of the liver that is normal? Yes. So is there a tracer in the small bowel? No, there's not. So should we give CCK now, or should we wait? So in order to talk about that, let's look at the schematic here. So indications usually are for chronic abdominal pain. If it's not, then that's an entirely different discussion. If we're talking about bile leaks and other things, so we won't talk about that. But if it is, do you see gallbladder at 60 minutes, and is the liver activity washing out effectively for you to say that it's a quality study? If it's yes, then should we give it? But we don't see small bowel activity. So what do we do in that case? So as a quote from Confucius, success depends upon previous preparation. Without such preparation, there is sure to be failure. Or in other words, each test is perfectly designed to give you the results that it